We hope that other states and cities and counties around the country can learn from the experience that we're having in the states to more quickly and better implement their state laws.
My name is Chris Goldstein. I'm with the Coalition for Medical Marijuana of New Jersey. I'm on the board of directors with Ken Wolski. He's our executive director and a registered nurse. We helped pass a medical marijuana law here in the Garden State last year, but we've been working through the regulatory implementation process right now. We're here to talk a little bit about that. I have to remind you that as big of a struggle as it is to pass a medical marijuana law, actually getting it working in your state may be an even bigger battle. This is one of the big transitions that you make. Once a bill is passed, you're working with a completely different set of individuals within the state government bureaucracy. So you have been working with legislators and legislative staffers. Now you're working with folks at the Department of Health and Senior Services or the Department of Law and Public Safety. So really the first step is identifying yourself to these different organizations within state government and building up that rapport, making sure that you're getting the patient perspective to the people who are making these decisions in state government. Again, in New Jersey, it hasn't been so easy, and it's probably not going to be as easy where you are either. But making sure that you're tenacious and dedicated to this process and making sure that you keep the communication lines open with state government is really an important part of this process too.
For the regulations to be enacted, the executive branch department that is empowered to enact these regulations will have to promulgate or spread the regulations. And they do this by writing proposed regulations first. In between the proposal and the adoption is a public comment period. And this is your time to comment. It's usually about 30 to 60 days on the regulations that the executive branch department has proposed.
There are many vehicles which we use to make sure that the patient perspective is heard by those officials. We can contact officials directly, but we can also put some influence on the public arena. Having press conferences, rallies, we had a stakeholders meeting with Americans for Safe Access here in New Jersey. Those types of events are effective in their own right to make sure that you keep the patient perspective out at the forefront and also the right kind of pressure on state government for the regulations you need to see proceed.
Yeah, this is especially important when you have a government that is hostile to medical marijuana, which sometimes they are. Yeah, I guess you can your expectations would be the government and the executive branch department is either going to be supportive of medical marijuana, it's going to be neutral about medical marijuana, or it's in fact going to be hostile to medical marijuana. And unfortunately, in New Jersey, we ran into the latter situation, and we had to take our public comment period to the streets, quite frankly, with our op-eds and our demonstrations at the State House and press conferences that we've held. So that's another way to, sort of have a public comment period on steroids.
And having that public comment period out there for the public to see, not just writing in letters to the state government officials or having some sort of email correspondence, but making sure that you share that correspondence with the public at large and also with the media is also an important part of this process. There are many medical marijuana patients who are homebound, and we as advocates and activists are really have a great responsibility to represent them in this process. So as we interact with state legislators, as Ken and I do, we spend a lot of time emailing these medical marijuana patients in New Jersey, trying to find out their concerns and perspectives, because it's our job to bring that out to the table. When you're out there working on your local level, don't lose that perspective. It's easy to get into the politics of this. We wish that medical marijuana was just based on science instead of politics, but you can see how systems work on global warming, and I don't think we're going to be expecting that for medical cannabis soon. So you really have to work within the system as it exists. Use every tool possible, but also stay close to your roots and make sure that you keep talking to the patients who you're there to represent.
And your goal with the regulatory process should be the same as your goal with the legislation that was passed.